with 5 people cured is almost like unheard of.
Right.
Because usually it strikes and there are deaths, and
I
then
know.
they start to get it handled, and it strikes again, and they get. But we have been able, with the support of the federal government and all our collaborative partners, Medicine Sans Frontiers, CDC, WHO, and a host of other volunteers who are highly experienced and knowledgeable in infectious disease, come together every day, actually twice a day, to brainstorm, to map out, to design action plans on what we need to do to make this a curtailed invasion. So that didn't happen then.
Right.
So we have, for our own case in Lagos, which is representative of Nigeria,
Yes.
we've so far our case fatality is about 30%.
Right.
So that kind of defies the 90% that has been prevailing. I believe Guinea has had about 50%. If we continue at the rate that we're continuing, and people are presenting early, and we're able to give them the extensive, intensive support when their systems start crashing, we may be able to defy even the 33% that we have. There is a chance for survival. And I want to seize this opportunity to again encourage people and healthcare providers. This is not something you hide. There's nothing to be ashamed of.
Exactly.
We didn't ask to get this. It was brought to us. And the people that suffered the most were frontliners, healthcare providers, who have families that have suffered as a consequence of the touch and care they've given them when they were sick. So we need to be more open in our thoughts and transparent, and be the professional that you're called to be.
Exactly.
If you have someone you suspect, Lagos State, in collaboration with all its partners, has made everything available to support you and the person you're concerned about.
Exactly.
And there is hope, but we don't want you to be afraid. We want you to know there is support in the system. Trust that there is support in the system. Call the helpline, the toll-free helpline, and we will be there for you.
And please, can you call out the toll-free helpline again?
0800, that's 0800 Ebola Help. It's a 14-digit number, so people get a bit confused because they expect the 11-digit number. But a 14-digit number, you have to dial all the numbers for it to go through. But we have actually, the helpline is manned by doctors, medical doctors. So they can answer not only social questions, they can answer clinical questions that are related to Ebola. Don't call about, you have a fibroid and you don't know what to do. Right. Because you're tying up the line for other people who may have critical questions, or even tips about someone who's sick. We got 3 of our tips from the helpline. The people called and said, look, this is what we think we're going on at this address. Please go and check it out. And we found
Wow.
So
I must commend the Lagos State government. If you're thinking about, or people believing in the system, people definitely have faith. You've done an excellent job.
Thank you.
We must commend the Lagos State government. You are doing absolutely wonderfully well, especially when it comes to calming the mass hysteria that we were having at the beginning. And I would like to say that even right now, there's a bit of a calm right now, and that is where we need to be, because like His Excellency said, this is a war against the healthcare system. It feels like we're in a war. There's a lot of panic, and it's contagious. But right now, with the outcome that you're having, you're talking about 5 being cured now. It is very encouraging, and I like the fact that you mentioned that we should encourage the hospitals to call out and say, oh, look, we have a suspicious case. Because I don't think enough credit is going to the hospital that did mention that they had Patrick Sawyer. Because somebody was like, oh, don't you think the reputation of the first consultant is now tarnished after mentioning this? It's
all about education and information. Information, they say, is power. Right. And that's why we come out almost every day to be open and transparent with the citizens of Lagos State and even Nigeria, to let them know that there's nothing shady about what is going on. First consultants, I think people don't get how much they saved the country.
I'm telling you.
If first consultant was not proactive and have a high index of suspicion, Mr. Sawyer could have been given malaria treatment and sent away.
Exactly.
He would have gone and stayed in a hotel.
True.
Would have gone to the bar. Maybe he was too sick, called for room service. He would have sat in the reception. You can imagine the number of contacts that alone would create in terms of direct touch. He was going to Calabar.
Exactly.
And he could have just dropped all this trail all the way to Calabar. And then in a convention, there is no telling how explosive this would have been. You know, convention is a happy, huggy, touchy-feely area.
Exactly.
But they detained him. They kept him, even when he resisted, because we heard that he became a bit upset that they were not going to let him go.
I know.
Even when his blood test was pending, the minute they found that he had this high fever, he was symptomatic, and he was coming from Liberia, doors were shut down.
Exactly.
And he wasn't happy. But they stood their grounds, and they kept taking care of him. He was belligerent, and he did some not too nice things that put all the healthcare workers at risk.
True.
Almost like a deliberate effort to get people infected. Unfortunately, that's what it looks like.
Like he pulled out his IV line, and there was blood.
He did quite a number of things that were not desirable of anyone, that meant well for anyone. Wow. But having said that, we still had those people stand their grounds.
Right.
They notified us, notified the Federal Ministry of Health, WHO. Within 24 hours, plans were kicking and rolling into place.
We know one of the victims that we have on the media, on the web, was Dr. Adedevo. Is that confirmed? Or because we know that we have the information that she got infected. She was one of those people that stood her ground and said, no, this man isn't going anywhere. And now she's doing better. So...
Yeah, I worked with her when this opened up, and she has a tenacity of.
I know.
I really, I have the utmost respect for her.
She trained me as a house officer.
Oh, okay, so you know her more personally.
I know her personally.
I've known her, by proxy over the years as a senior colleague. Yes. But with this episode, we started working together. She came to our meetings and all of that. As of that time, she was not going to take anything less than what was recommended. True. And yes, she did stand her grounds and say no, he wasn't going anywhere. She was she was in charge. Right. She was in charge of the affairs of the hospital, secondary to the CEO. Yes. So she was very vital in key decisions that needed to be made. And without her prudent decisions, we will not be talking about what we're talking about today.
My goodness.
It would have been catastrophic.
My goodness.
I think she spoiled us a bit for not really experiencing what Liberia and Sierra Leone experienced.
Wow.
Yes. So first consultant will get back on his track. Government will support first consultant.
True.
It's not a dead end.
Yes.
They're not a dead hospital.
At all.
We're decontaminating, and it will be used again. They will have patients again. They are a first-class hospital.
Other hospitals should take their cue from first
consultants.
And
we're really putting that on the line that, they have been very professional despite the risk.
I know.
And that is what we're called to do as healthcare providers. When we take the Hippocrates Oath, this is what healthcare is
about.
Yes, and they have emulated it in every ramification. We're still praying, and she's pulling through every day that she makes it, brings us closer to a chance of recovery. So we're very hopeful. Right. That it would be the most victorious thing if she can come back out and talk about this experience.
Exactly. That would be like you're getting the information even from somebody with the knowledge. Yeah. So she's going to have all that information and background to back her experience and let people understand what is happening to us. I should just mention at this point, because I know this is going to go on the radio, that we're talking with the Special Advisor on Public Health to the Lagos State Government. That is Excellency Babatunde Raji Fashola. We have with us Dr. Yewande Adesina, and she's giving us all the scoops. Now,